Vitamin D deficiency can manifest through various signs and symptoms, and it plays a significant role in numerous bodily functions, including insulin resistance, immune function, and potentially COVID-19 outcomes. Here's an overview. Bone pain and muscle weakness. These are classic symptoms, often subtle at first. Fatigue and general weakness, a common but non-specific symptom. Mood changes, including depression and anxiety. Impaired wound healing, slow healing of wounds after surgery or injury. Hair loss. In some cases, severe vitamin D deficiency can cause hair loss. Frequent infections, particularly respiratory infections. Vitamin D deficiency can have an impact on various body activities. Here are a few examples. Insulin resistance. Vitamin D plays a role in insulin secretion and glucose tolerance. Deficiency can contribute to the development and progression of insulin resistance and type 2 diabetes. Immune function. Vitamin D modulates the immune system. Deficiency may compromise immune response and increase susceptibility to infections. Bone health. Vitamin D is crucial for calcium absorption in the gut, which is essential for maintaining bone health. There have been studies suggesting a link between vitamin D deficiency and higher COVID-19 mortality. These studies hypothesize that vitamin D might influence immune responses to respiratory diseases, including COVID-19. However, it's important to note that these studies often point towards a correlation, not necessarily causation, and more research is needed to fully understand this relationship. The optimal blood level of vitamin D is still a topic of debate. Recent studies have investigated the association between vitamin D deficiency and COVID-19 severity and mortality. Here's a summary of key findings. Association with COVID-19, severity and mortality. A systematic review and meta-analysis including 17 observational studies with 2756 patients found that vitamin D deficiency was associated with significantly higher mortality, higher rates of hospital admissions, and longer hospital stays compared to those with non-deficient vitamin D status. Impact on COVID-19 outcomes. Another systematic review and meta-analysis examined the association between serum vitamin D levels and mortality in COVID-19 patients. This study included analyses that adjusted for age and other confounders like obesity, hypertension, diabetes, renal disease, and cardiovascular disease. Vitamin D supplementation. A retrospective cohort study focused on the association between vitamin D supplementation and COVID-19 infection and mortality. This study used a large sample of patients and explored various aspects, such as the dosage of supplementation and differences in response by race and gender. Global health threat of COVID-19 and vitamin D. The broad spectrum of disease severity and fatality rates due to COVID-19, coupled with the global prevalence of vitamin D deficiency, has led to hypotheses about the potential role of vitamin D status in influencing COVID-19 outcomes. These studies highlight a correlation between vitamin D deficiency and increased severity and mortality in COVID-19. However, it's important to note that while these associations are significant, they do not necessarily imply causation. Further research, including well-designed clinical trials, is needed to explore whether vitamin D supplementation can effectively decrease the severity of COVID-19.